Good afternoon, ladies and gentlemen. I wish I could be with you today in person in beautiful Athens, but I will be sitting on a plane to Japan when you see this video. I hope you just had an inspiring day discussing about cancer care in Greece. At the Swedish Institute for Health Economics, we are currently also running a research project about cancer care in Greece, and my intention is to give you a short preview of this current project. We call our latest project Cancer Dashboards in Europe, in European countries. This is sort of an international initiative aiming to facilitate the exchange of best practices in cancer care among European countries. And we are currently working with 6 countries, Greece being one of those countries. And the dashboard, what is a dashboard? A dashboard is sort of a monitoring framework, and a monitoring framework that tries to cover the whole continuum of cancer care. It includes indicators for different areas of cancer care. So, for instance, for the area of prevention, it could include indicators for the smoking rate, alcohol consumption, obesity rates, or the HPV vaccination rates. For early detection, it could include the screening participation rates or the participation rates in screening programs. For diagnosis and treatment, it could include the availability of physician, nurses, the availability of diagnostic equipment, availability of cancer medicines. And for the last area of survivorship, it could include indicators for palliative care services, rehabilitation services. But it's also important to include indicators related to the aims of cancer care, such as reducing cancer incidence, reducing cancer mortality, and improving survival rates. And all of these indicators that are part of the dashboard are supposed to show the current status quo in a country such as Greece, and it should also show how far away countries are or how far away the status quo in a country is from a national or an international target value that has been defined by a national body or an international organizations, or it could also be the EU average. And I'd like to show you an example today from the country of Poland, because we don't yet have results for Greece. But I'll show you Poland. We published this earlier this year in January, and you see that we have built the dashboard around a set of areas and indicators for each of these areas that you saw on the previous slide. And it shows how far away Poland is from the benchmark. The benchmark is in the middle, that's the yellow area, but you see that all of the blue bars, the horizontal bars that are emerging, are mostly stopping in the red area, meaning that Poland in areas of prevention, early detection, diagnosis, treatment, and survivorship always tends to be below the benchmark values, which could be either a national aim or the EU average in that case. And you also see that at the end of these bars, there are circles with triangles, and these triangles show whether progress has been achieved in recent years. And many of those triangles are either green or yellow, meaning that there is progress that is happening. So Poland seems to get closer to the yellow or even the green area in this dashboard. And we are currently building something similar now also for Greece. So please, everyone, stay tuned for the publication of the IHE Cancer Dashboard for Greece in the coming months. We hope that this project can also inspire and encourage a future introduction of a national cancer control program in Greece. But for now, thank you very much for the opportunity to speak to you today online, and have a great rest of the conference. Goodbye.